Okay, well, welcome back.
Oh, the video went dead.
Is designed to address an editorial that appeared the day that it was announced that the Senate had come up with a gun safety measure. The 10 Republicans that had signed on to it, something I had worked on for weeks with members of our congressional delegation. Senator Collins and Congressman Golden were all aware of the policies that were in there, and we helped shape them. So the day that that came out, the Press Herald, and a few days later, the Kennebec Journal ran an editorial that was titled, Maine Can Do More to Stop Gun Suicides. It contained a series of, I guess, opinions that really are just not true. And I think it's important to address them. I reached out to the Kennebec Journal twice now and once to the Press Herald asking to talk to their editorial board. Having done this for over 20 years, it was obvious to me that they had talked with the Gun Safety Coalition and others. And I was very disappointed that they had not talked to us. I was the one in the back room with all of the individuals that I'd mentioned in a previous segment, some of the best legal minds in the state, legislative leaders, the governor's office, to work on the reforms that became was the so-called yellow flag, which is the reforms of protected custody. So I know firsthand what happened. The Press Herald knows that as well. So does the Kennebec Journal. Why they didn't call us to get our perspective before writing this editorial is very disturbing to me, and I view it as very unfair. The press is supposed to be balanced. The press says that it's balanced. That means you do your due diligence. You talk to all the players, particularly those in the know. So I'm going to begin with the title. Maine could do more to stop gun suicides. I would have said to the Press Herald, Maine could do more to stop all suicides. All suicides are tragic. A family's been impacted. A person has lost their life. My organization recognizes that. We've been working for years with groups like the Bureau of Veteran Services, veterans in crisis, potential suicide situations. We've worked with them on education programs to help families secure firearms in the home. We just passed legislation, SAM legislation, to create state and federal grants to families in crisis to secure firearms and other dangerous weapons, including prescription drugs in their home. Our organization was, and I wasn't the director at the time, introduced legislation which created the protection from abuse orders that are now in state law that have saved countless lives and abuse of domestic violence victims. My organization was the one that identified thousands of records in the judiciary of prohibited individuals with a mental health condition that prohibited them. We were the ones, and our board member, Paul Davis, Senator Paul Davis, and myself, who spearheaded the judiciary getting that information to the NICS system to save lives, to ensure that prohibited individuals could not buy firearms. It was my organization that created the School Safety Center. My organization that created the protective custody reforms. My organization that led the effort to create sales tax exemptions on gun safes and other safe storage devices to save lives. Nearly every, firearms safety policy over the last 10 years, my organization has had a lead role in creating. So with that, let's move into their editorial. They began by talking about the very serious issue which we share their concerns around the high rates of suicides in the state of Maine. There are many reasons people consider suicide. It can be from drug addiction to depression to mental illness. All of them warrant resources and ways to prevent those suicides, not just the firearm-related ones. We're committed to those policies that protect an individual, not just from suicide with a firearm, but all elements of suicide. We also support connecting them with the resources that they need to get better. So with that, I want to make this about all suicides. And I want to get to some components of their editorial that I found very personally hurtful. I'm going to get to this section in their editorial. In 2019, Maine passed the so-called yellow flag law, which was supposed to offer a way to get guns away from people in crisis. No, it wasn't. It was also designed to help people in all crisis situations, not just with firearms. It was protective custody if they're a drug addict to get help, if they're depressed to get access to the health care that they need. It was to reduce access to all dangerous weapons, not just including prescription drugs. And that I can speak more to that if you have questions a little bit later. But in order to, this is another part of that same paragraph. But in order to overcome the objections of groups that fight any restriction on firearm or firearm regulation, it was watered down to the point that it is virtually unusable. That paragraph is the most offensive of this editorial. I was in the room. Nobody ever negotiated to water down that bill. What happened was the best legal minds in the state, two ex-attorney generals, one person, Senator Carpenter, who was originally in favor of the red flag, recognized that this was a better proposal and said, I'm going to switch and try to work on this one to make it better. The Governor Janet Mills, is an ex-attorney general. Derek Langhauser has worked for both Republican and Democrat administrations. In my mind, he should be a judge in this state. A class man who puts personal liberties first, and in my mind is probably one of the best legal minds in the state, was in that room, along with John Chapman, a lawyer who works on police shootings and some of the most sensitive mental health crises in our state. He's our attorney. Those are the folks that were in the room. Nobody said, let's water this thing down. What we said was, let's work on a solution to the problem that we believe can save lives, and at the same time honor due process and personal liberty. That was the only goal. My organization does not oppose every gun bill. I've listed the proposals that we've been part of. When there's a solution that's needed, my phone is the first to ring. My organization's credibility is the one that people lean on to find solutions to controversial policy. That was personally insulting to our organization and to me. The Press Herald knows who was in that room. They didn't mention us by name, but that was a backhanded way of minimizing our organization's influence and our commitment to the safety of Maine people. In that legislation, what we did was we created a new process, first in the nation, that used our protective custody to capture people in crisis who are in the police custody. They went on a little later to say that only the police can do this, not individual family members. That is not true. In order for the police to get called to warrant a protective custody situation, someone has to call and say, a person is acting irresponsible, they're acting like they're mentally ill, and they're somehow a threat to the public or themselves. That is the way that people interact with the system. And it is a way for family and others to inject themselves in this yellow flag process. What happens is the police come, observe the person, and say, yeah, there's probable cause to believe that complaint. They then take them into custody. They take them to a medical professional to be assessed, and then ultimately to a judge to confirm that that person should have their firearm rights taken away. During that process, all the highest levels of due process are honored. Explain to me why that is a so-called unusable system, and I'll answer that for you. The medical profession, the Maine Hospital Association, wanted no part of this. They did not want people in a crisis in their emergency rooms. The Press Herald and others knew that. The gun rights community knew that. The medical professionals resisted those assessments until the first in the nation telemedicine component was developed. There was nothing wrong with this legislation. What happened was the telemedicine component was delayed because the medical associations did not want these individuals in their hospitals. These groups knew that as first in the nation, it would take some time to develop. That was why it was used in a limited way, not because the law was flawed. What has happened is in the last legislative session, and now in the federal legislation, and I'll get to that in a second. The last legislative session, that process to create that telemedicine component so vital to rural states without mental health services, that was ordered and developed. Now that system in Maine has that telemedicine component. Now this law can move forward to its full implementation. Well, in my federal discussions with Senator Collins and Congressman Golden, I stressed the need to include and make eligible for federal grants the protective custody reforms and this telemedicine component. The reason that the federal legislation highlights telemedicine is because I helped negotiate that into the federal package, and the people at the federal level, Democrats, Republicans, the president, recognize the importance of that component in this federal legislation. Ironically, my organization helped create most of what's in this federal package. We got insulted by the Press Herald for that work, and the gun control groups are trying to undermine it. That is unfair. That telemedicine component, its intentions are these. For all states, whether they have red flag, yellow flag, or protective custody reforms, every state in this nation deserves, every citizen deserves access to mental health services. Every state is different. Rural states are not equitable with urban, rich states. We don't have unlimited amounts of medical professionals in our rural states. This telemedicine component is not just crucial to this issue. It's crucial to all the individuals who need those mental health services across our nation. If you live in Kittery, Maine, or you live in Fort Kent, Maine, you deserve the same access to mental health services. Absent that telemedicine component, are we surprised when a person in a mental health crisis with no access to the care that they need in their services go on to commit suicide? Can you decline, please? My point is, the Press Herald knew these things. They knew that these mental health services and being connected was a crucial part of this. Don't use your prejudice toward firearms to blind people to the opportunities that we have to make our communities safer. At this point, I'm going to stop because I'm out of time. But obviously, you can understand why for years and being on the inside, working through multiple policies to make our communities safer as it relates to violence. When we're dismissed and said that we're trying to water down legislation, when we've committed massive resources in our credibility, and I will tell you listeners, anytime you talk about impacting firearm rights, it creates a controversy. I've lost members over it, but I had the courage to stand up on behalf of SAM and do things to make our community safer. Don't demean our commitment to those efforts by writing editorials that minimize us and the work that we have done. And with that, I'm going to stop and take any questions that you may have.
As I don't have any at the moment, if Becky does, I'm not sure if Becky does.
No.
All right, with that, thank you. These three are going to be posted. Obviously, if people have questions, they can post them when you post them on our Facebook page, and I will try to answer them as they come up. What I will do is I will accumulate those questions, and then I will come back and I will answer them all on a future YouTube video to address them. And with that, thank you, and thank you to the listeners.
Thank you, David. These will be up on the Sportsmen's Alliance of Maine page. They will also be up on the SAM-ILA page. They will also be on Sportsmen's Alliance of Maine YouTube channel. And please, 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 David, thank you so much for your efforts and all the staff at SAM. Please join SAM at officeofsamofmaine.org or www.samofmaine.org. Thank you so much. And with that, we will end it.